Welcome to the Sleep Well Journey podcast. Before we get started in this episode, we have just started a Facebook page for dentists who are ready to start doing sleep in their practice or who are already doing sleep in their practice. And so you can find that on the sleepwelljourney.com, and you can find the link to the Facebook page there, or you can go to Facebook and search for a Sleep Well Journey community, and that's where we'll be. We're there to just
educate and
empower. This does not need to be a community that's closed off to one another. This needs to be a community that uplifts and looks for success, ways to be right, not ways to be wrong.
Correct. All right, guys, I'm so excited. Hello, my name is Dr. Callie Hale.
And I'm Dr. Kyle Hale.
And we have an amazing guest with us today. We have Michelle Saltarrelli. Did I say that right?
You did.
Good.
Excellent.
And she is an audiologist and a speech language pathologist. We met about a month, not even,
a
couple
weeks ago. Yes.
And she was so impressive. And I was so excited to have her on the podcast. And I'm so thankful you're here. Tell us about yourself.
Sure. So I'm originally from New Orleans. I studied in Louisiana, moved here about 17 years ago now.
Okay.
I've been practicing as an audiologist and a speech pathologist, did my residency in the Med Center for Audiology. Then I just started working, and then I opened up my own private practice, Autumn Oak Speech, Voice, and Hearing. Amazing. 12 years ago. Yeah, 12 years ago. I did a year of research about, just making sure I got the right spot and all the right credentialing, all that kind of stuff in order. And I started that. And the primary reason of why I opened up my own practice was because my oldest son, he was born with special needs. Mm-hmm. So initially we were told that he wouldn't be able to do much. He would probably be dependent on us as he grew up, wouldn't be able to go to school, drive, work.
Wow.
Well, actually, fast forward to 16 years or 15 years later, he's actually not like that at all.
Awesome.
Right.
Good.
Yes, with the grace of God,
Yeah.
and just pushing him and making sure we get the right intervention, the right specialist. And but I opened it up based on him because everybody, including people with special needs, needs to have a purpose.
Absolutely.
And should be able to work and have the accommodations to work. So that's why I started. He was pretty much my inspiration, and we're still going strong.
That's so cool.
Love that.
Yeah. And so, and it's looking like probably my sons will probably rotate in and help, at the clinic as much as they can.
Oh, that's fantastic.
Yes. And as they figure out what they want to do with their lives. But yes, but the reason why was just to make sure that I had a legacy to leave to my son, because biologically I was going to outlive him. I need to make sure I still took care of him past my days.
Yeah. Oh, that's so special.
Yeah.
So you've been a small business owner for a long time in the trenches with us.
Yes, I have been. I mean, it's just, I have that analogy of like, it's pushing that train up the hill.
Right.
And then once you get it past that peak, right, the momentum just goes and it evolves, and you have to evolve with it.
Right.
Because if we're not revolving, we're regressing pretty much.
Absolutely.
100%.
Yeah.
Oh, that's fantastic. How many people do you have on your staff?
We have 2 clinics. So we have Hearing and Balance on one side in Friendswood, and we have another audiologist, and then we have support staff with them. And then on the other side, we have 6 speech pathologists and therapists, and goodness, we even have a music therapist.
Oh yeah, that's right. I remember you saying that.
Yeah, we have a music therapist. I'm trying to build a full-blown rehab for both children and adults. So I'm looking for an OT and a PT, but I'm looking for business owners in that realm to partner with.
Yeah.
Awesome.
But yeah, there's 15 total.
Okay.
And they're all in Friendswood, Texas.
We're all in Friendswood, Texas.
Awesome.
Yeah.
Okay.
So we just split the audiology and the speech pathology, the rehab side.
Yeah. Oh, that's fantastic. So you're not far from us at all.
Hold on, I already got a good question.
Okay.
Yes.
So one of the things that we talk about on the show pretty often is, and on the orthodontic side, is there's kind of just like, oh, it's time for braces. And so you go to the orthodontist and you just kind of get the regular prescription, and the soapbox, Callie, I'll try to keep her off of today. The soapbox
She's heard it once already.
I've heard it, yeah.
is pulling bicuspids because they're called extra teeth. And so that kind of falls into this category of, well, the patient doesn't know better. Like they don't know to ask the question or to
No, we
think that
don't.
it's not right.
We're just going along.
Right.
And so I imagine 15 years ago when you're getting told all this stuff about your son, you may have been in a really similar boat. So I want to, if you're okay with me getting kind of personal for a moment.
No, it's fine.
Why did you think that there was an opportunity for it to be any different than what they told you?
Neuroplasticity of the brain. I mean, it's going to change based on the environment. It's going to change based on external factors. I mean, he was a baby. That was the most vital time. If I was aggressive with his treatment, I knew I could change possibly his outcome. Maybe it wouldn't be as severe,
Yeah.
Does that make sense?
100%.
They're telling me he's going to be the most severe that you can even think of as a person, right?
Yeah.
Just totally dependent on the parent the rest of their lives eventually. That's that's hard to hear. And actually, I wasn't supposed to hear that. That was the physician telling his residents, teaching his residents about my child that I overheard.
Oh my
But you know
gosh.
what? I needed to hear that. I really did, because it was that moment, even though a tear was trickling down my face and I was trying to be so strong for my son because he was a toddler, already kind of scared in this environment. I thought to myself, that's not going to be my child. I mean, we can work with this. I mean, maybe it could have been, but I didn't. It wasn't, because of the neuroplasticity of the brain. So if we can get everything changed up before, he's an adult, before he's 12 years old, we can do so much more.
Yeah.
And that's where it came into play for me.
That's so cool, because I think there's a lot of blind trust put into a lot of components of healthcare where you get told something and
you just accept it as fact.
You feel handicapped and you kind of like, or you got your hands tied behind your back, like, oh, well, I mean, that's what they said.
I know.
And it doesn't sound like that was the case for you at all. You just kind of...
No, like it wasn't going to be my child.
Yeah.
I mean, and if it was, but I was going to give, I was going to fight my
100%.
hardest
Right.
to help him, because what kind of life is that?
Absolutely.
Yeah. So that's why I think part of it was my education, right? The background, because that's when my profession and my personal life totally crossed paths. And then it was just like, okay, what do we need to do?
Right.
I mean, and also the amazing, like the neurologists over at Texas Children's were amazing. They were like, read this book, read this book, read this book.
Fantastic.
So I just read everything they gave me.
Wow.
And then it just got to the time when it was like, I want brain surgery for my child. I want it now. I don't want it when he's 12. I want it now when he's like 3 going on 4.
Yeah.
And there was a 50% attrition rate, but it didn't matter to me, because it was like I was watching him slowly die in front of my eyes versus just peacefully on the OR table.
Right.
I'll take my chances, because his quality of life was just deteriorating.
Right.
Exactly.
As
What was the
years
diagnosis?
It was actually Sturge-Weber syndrome. It's a very rare syndrome.
I have
It's a
heard of
fluke.
that, though.
It's
Wow.
a fluke in utero. It's a and that's what he had. But we didn't know until he had a variation of it. So they didn't really definitively. They were like, "This is Sturge-Weber. This is what it is. This is what his anatomy looks like inside." But physically, he looks just like a regular boy.
Wow.
I mean, he's on heavy duty epilepsy, like anti-seizure medicine, because that's the characteristic of it that's really detrimental to their brain.
Yeah, for sure.
But essentially his right hemisphere and the vascular system what do I want to say? The vascular system that provides to that hemisphere, it's all malformed.
Oh, I see. So less blood and oxygen's getting to that.
Yeah, it's all just malformed. The right majority of the right hemisphere is not used by him. It's and so because of all the malformation, it's like trigger points, focal points for seizures, massive, horrible, degenerative seizures. So, yeah, I mean, when he had a seizure, I had, heavy duty medications to knock him out.
Yeah. Wow. Oh my goodness. So
was-
they did the surgery.
They did the
which
surgery.
was
And that was when he was 4. It was December,
Wow.
December of 2011. I want to say it was December 16th, 2011. And I let him go. And they told me that if he survives, that he would look like a stroke victim, hemiparesis,
Oh my gosh.
that kind of stuff. And I'm like, well, we can rehab him. That's perfectly fine. We can rehab. And then he got out and he was calling for me and he was ready to walk and talk.
Oh
and
my
so he was like
gosh.
totally different.
Wow.
So it wasn't anything, but I think the physicians were just really trying to prepare me for like the worst scenario.
Absolutely.
Right.
And
Which
I
they
was
needed
okay.
to do. Right.
Exactly. So, he didn't turn out to be any of that. And,
Wow.
and we've just been doing, we see our specialists, our child psychologists. We've been doing speech therapy. We do tutoring.
Yeah.
Yeah. And now he's in high
amazing.
school full time, and he's in ROTC. And actually he's in high school right now getting promoted to modified gen ed.
Wow.
So, it's things like, even though I heard the absolute worst prognosis for him, it didn't turn out that way.
Right.
So
Yeah.
Yeah.
So we just, that's so powerful.
You are one tough person
Absolutely.
to do all that. I mean, I'm serious. Like,
Absolutely.
Don't get me wrong. It's been a hard road.
I imagine.
I'm part of the 87% of people that are divorced because you have a son or a child, which hopefully that never makes it to my children's world.
Right.
But I'm part of that percentage.
Yeah.
We didn't make it, but my child survived.
Yeah.
So I have to be grateful.
Absolutely.
So it was dark days. It was
Yeah.
really dark days,
Yeah.
and it's it was hard. And then and unfortunately that's the year after is I'm opening up my business.
Yeah.
For my son.
Gosh. Yeah.
And I'm doing it on my own with no
Wow.
help and my two
Oh
boys.
my gosh.
And now but fast forward, it was the first 3 years were really tough and hard. You're just getting that momentum and pushing that train up the hill. And
So true. We know exactly.
oh my goodness, it's like a business owner.
Wow.
I mean,
yeah.
you have to survive. I mean, at least for me, it was like there was no choice of failure.
Right.
Yeah.
Yeah.
So, it was
that's
just
amazing.
no choice. My favorite song is NF Options.
Yeah.
Oh my
Yes.
gosh,
I
we
love
love
it.
it.
It is
I
so
love it.
motivating for me as an entrepreneur, right?
Absolutely.
Like I have no option to fail. I have to
Yeah.
succeed. I
Yeah.
have to start making money now to help my boys and I
Absolutely.
to survive.
It's amazing.
And then so after as the years
Oh.
progressed, and then like I just shared with you earlier, like finally I'm such a niche field, speech pathology, audiology. You find the right medical biller that knows your industry. That
Right.
makes all the difference in the world too.
Yeah.
Yeah.
Yeah, I was showing her our centralized billing area, and she was like, "That makes all the difference in the world to have somebody that knows what they're doing there." And I'm like, "Absolutely."
That knows your niche, that knows,
Yeah.
that understands and looks further into deeper, onto
to help
that.
patients get
'cause
coverage or whatever.
To help them get coverage, to make sure your cash flow
Yeah.
is flowing,
Right.
right?
We can go to work all day, but we have to get paid for it.
Absolutely.
That is the
Absolutely.
hard part of this.
Yes, and like where for the longest time it was like I was a money launderer, not for anything other than like I would pay all my bills, pay the
Yes.
payroll, and by the time you looked in the bank account and maybe there's a few $1,000s there in the early days if I was lucky.
Absolutely. Oh,
Yeah,
yeah.
I
for
think
sure.
at one time I had $20 in the bank, and I'm like, "That's it."
Totally
I
been
mean,
there.
I'm either
100%.
gonna make it or I'm not, but I'm gonna try.
You paid everything. Hey, you guys.
I know exactly,
You're staying alive.
but like that's
Staying
what.
alive.
No, that was my joke. I'm like, I'm literally a money launderer.
Yeah.
That's what I am. But I'm like in the industry of speech pathology and audiology. I'm not doing anything else.
Absolutely.
Yeah.
Oh,
Callie and I had bought our first practice, and we just had my daughter had just been born, and we was like the 4th or 5th month in, and we had to make payroll, and we're like up late at night calling all these different banks, trying to find all these
That's what it's
fast
like.
loans to make
Oh
payroll.
yeah, high interest, short term,
Absolutely.
and you're like, I'll sign it. Just
Yes.
give me a pen.
Give me
I'm ready
$5
for you.
grand. I
You
need
want to
it.
you're going to give me 50 grand for 100 grand towards you? I'll sign it right now.
And it's really cool because
Oh my gosh.
those problems of yesterday, I mean,
They
it
help
sounds
you.
like you've gone through a really similar path where I bet people will look at you go through problems, new business owners, and they'll be like, "How are you so calm?" And my managers ask me this all the time, like, "How are you so calm?" I was like, "Been there, done that lots of times.
I know exactly.
I'm calcified."
I'm numb. No,
It's so
for,
true, though.
For me, it was my son. Almost losing my child. There's nothing more stressful than that.
No.
You know what I mean?
Yeah,
That's
nothing
what
else
helped
matters.
me through those first
Yes.
few years. Like, hey, I got my health.
What's
my son
reality?
survived.
Absolutely.
That's what helped me get through. But yeah, but yes, it's you're gonna make it. It's everything will be
absolutely.
fine.
Absolutely. You
Everything
just have to
will-
remind yourself of that
I know.
sometimes
It'll be
because you can be in
fine.
the thick of it and you're like, how are we
Absolutely.
going to get out of this? Yeah.
I know. It's
So this podcast is all about motivation and, and leadership, and you guys will guys will be fine.
Exactly. But yeah, it's not, entrepreneur is very, what did my dad say? Because my dad's one too. And he was just like, it's big highs and big lows.
Yeah, for sure.
That's what you experience.
100%.
Yeah.
Sometimes you're only remembering the lows and you forget some of the highs too.
Right. I know. And you do, because you don't celebrate those small little accomplishments.
Right.
And I try
And you
really
need to.
hard
Yeah.
to, like like, hey, wait, step back.
This
really
is a win.
appreciate
This is
this.
a-
Yes.
right.
Really take it in. But instead, where our minds are like, what are we going to do next year? What are we going to do in 6 months? What am I going to do next payroll?
So that's
I'm
my
giving him a
job.
look.
Callie can go on vacation in 30 seconds. And it
Like
will-
once we get somewhere, I'm like,
we'll
hey,
be
we're
3
here.
days.
Let's enjoy it.
Yeah, we'll be 3 days into a 4-day vacation. I'll finally be relaxed. And they're like,
Yeah.
oh, we got to pack up, go home. I'm like, well, this is great. I had a day off. But
Yes. It is hard to really step out.
Yeah.
Not to share so much, but I have a counselor, obviously. I mean, I've been through a lot in my life
Absolutely.
already. So I
Sure.
see a therapist. I tell her that she's now my business consultant at this point.
I love it.
Because that's what she helps me cope with.
Yes.
And she was like, entrepreneurs and preachers have a hard time with separating.
Mm-hmm.
Like you really have to carve out your me time and your family time because our heads are usually in the business.
all the time.
I heard a guy talk one time, and this was like early on. I think we just bought our second location, and we had 7 earlier this year, and we actually sold 2, which was really good for us. And
Yes, sometimes you do. Yes.
but I heard a guy say, and I can't remember who it was, but he said, stop bringing your laptop home. Because, it's not like I have a briefcase with paperwork in it.
Right.
This is not 1980, you know? And so I was bringing everything home on my laptop. I'd open it at the dinner table. I'd open it in bed. And then I'd go to bed, set it down, pick it back up in the morning. And I was just constantly on my laptop, checking things and working on things. And once I stopped bringing that home, I felt like that was
Work
the
is
release
here,
I needed
home is here.
to be
Right.
home. Because I had
Yes.
young babies, and they were
Yes.
so much fun to play with. And I
I
love being
know.
a dad. And
Exactly.
So, but yeah, that was the moment where I felt like that was a weight lifted. I still can't go on vacation.
Yeah, I'm working on that. Don't worry.
Right.
She's working on it really hard.
Right. That's that's going to come. It's going to evolve where you
Does.
can.
And I'm very appreciative for those, even though I would, berate him about closing his laptop and stuff now, where we are now on the other side of it. I am very appreciative that he was putting in the
Hours.
grind and the hours.
Calcified.
But,
now.
Uniquely circling back to
Somebody
what
has to do it.
That's right. That's right. And it's not
I
her.
do
Somebody
do it
had to
all
be
the time.
sacrificed
She's
out
the
of here.
dandelion over here. Yeah.
Oh, you guys.
She'll
know
get
that
an
it's not
email
true.
that
Oh,
she'll get an
you're-
email that someone quit, and I'm like, oh, okay, well, let's start the hiring process. And she's like, what are we gonna do?
That was
I
old
can't
days.
go to
Now I'm
work
just like-
without this person. It's like, it'll be fine.
Oh
Yes.
my gosh, that's
You've
so
done this 3
funny.
times already, and you just,
We stress very differently though. My stresses are very much clinical patient outcomes, like trying not to take that home as a different,
Yes.
therapy session and podcast for another day.
Yes.
but
no,
it's true
I know.
because you can't
it's
help
very
it.
true. And actually,
Deeply care.
I know my husband just finished his first year, so he's working with us now too. And we kind of say like
met
I'm
him
the
too at the-
I'm the CEO and he's like the CFO because he's like my mindset just isn't that way. Like I'm more visionary. I'm thinking,
That's
you
Kyle.
know, yeah, I'm very much that. I'm not. Details are too tedious for me. So
And I'm like, we got to have the details. Like,
so that's where
so
Wes
funny.
steps in. I mean, I don't know how I made it all these years beforehand. Actually, my team
Yeah.
helped to organize
For
me and
sure.
keep me together and make sure because
Focus
I was
you and-
very much like, patient or, oriented. It was all about my patient and then about my staff and making everybody. Yeah. So that's my brain. And then his brain is the complete opposite where I need him to keep it all together.
Yeah.
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 well, I know that with what you're doing being, it's very niche. That is not Farley. Is that a word?
Farley.
That's okay. It's a new word now.
Yeah.
Finally.
Thesaurus 2.0.
That is not far in association from what it's like for us being an
Oh, I'm
airway
sure.
dentist, because we are very much against the grain. We're challenging the narrative
Right.
every single day.
Yes.
We're challenging not accepting a diagnosis.
Yes.
And unfortunately, the
You're
diagnosis,
innovative. You're changing.
we have to be. And so
You're
you,
trailblazers.
yeah.
That's-
And we are. You as well, because it's like for what we're trying to do, getting anybody to fully accept it in, I would say, even the provider community is difficult. Now there's more and more research and more loud people yelling about it that I can almost sit back sometimes and be like, hey, you didn't hear about that? It's old news. Don't you know we don't pull bicuspids anymore for whatever? But the
Right.
problem is in the diagnosis, similarly to, I think,
With
not
my-
to the
yes.
severe extent. as
Right,
you're saying,
no,
but
of course.
the diagnosis of bimaxillary protrusion, meaning the upper jaw's too far and sticking out, so you got to rein it back. And,
Right.
and I was talking with a dear mentor of mine not long ago, and he said if that diagnosis would be eliminated, then they wouldn't be able to pull the bis.
Yes.
Because that is, if you have that diagnosis, then it's acceptable to refer the patient for, and when the diagnosis needs to be maxillary and mandibular hypoplasia. So as we have developed these niche services, how, when you came and Bree reached out to you, I think, and told you we
Yes.
were having the dinner and all
Right.
of that.
Yes.
So with what, because you shared some cool things when you talked that night too, when we were kind of all introducing ourselves, but how does Airway, if it does, this is just a blatant question, how is that related to what you do?
I do?
Yeah.
So I'll tell you, as a speech pathologist, so that's the biggest area that it's related to for me. So in regards to that, what we're seeing are like major behavioral issues,
Right.
which at this point too, we can't figure out and rule out if it has to do with just being COVID babies,
Right.
or the world of phone and camera on the phone.
Right.
Because we have some, in my 20 something years of practicing, I've never seen like the behavioral issues that we're having today.
Wow.
Yes.
Yeah.
Yes.
Wow.
The Airway, no, but that's why I went to your area to understand it more, because now I learned from you, it's like, okay, if we can get, if we can see what the oral motor structure looks like, the oral muscular, what's in the mouth, what does it look like, is it giving enough room to breathe, which that would be your expertise,
Right.
Will we see these behaviors reduce, will we see a happier child? So now I'm like asking different questions, and I'm seeing things in a different way. I mean, I am trained in oral facial myology, but never certified in it.
Yeah.
But and so like I looked a lot for like tethered tissues,
Yeah.
if it's affecting the speech production, which it doesn't really affect the speech production. What it affects most is the feeding.
Yeah.
Yeah.
Oh, for sure.
But it has other, disadvantages when you have all these tethered tissues, in regards to, as cleaning the teeth and the airway and all that other stuff, all those secondary kind of things that people just don't know beyond. And that's what I needed to work with. And that's what I wanted to see. And so that's why I came to your thing.
I love
Yes.
that. Yeah.
Right.
So I want to back up. What is audiology?
Okay. So great question. Thank you very much. So audiology I'm essentially a hearing doctor. That's what I do. So I treat balance disorders. So people that live with dizziness, like they're dizzy all the time, but they're taking medication for it and they've been dizzy for years. Those people really need to get the right diagnosis.
Right.
Around here, it's unfortunately, I'm learning that people just get medicated to mask the symptoms. But if we figure out really what's going on, we can help treat it more appropriately. So we deal with vertigo disorders, and then we also deal with hearing, and tinnitus.
I was going to
So
ask you
the
about
ringing
that,
in the
actually.
ear, that
Right.
kind of stuff.
Yeah.
So we treat all that. We diagnose it and treat it. So that's what I do. So we work over at Autumn Oak Speech, Voice, and Hearing. We deal with both adults and children, and we do cochlear implants, hearing aids, tinnitus treatment, that type of stuff.
So tell me more about tinnitus, like what causes it and how y'all treat it.
So we don't really know what the cause, like the exact cause. Now, what we're thinking is that, the body is a natural like healing machine.
Right.
Like the body just wants to like help heal itself. Well, unfortunately, in the areas of hearing, it's totally different. It's actually counterproductive to what we're trying to accomplish than helpful. Okay. So what we think it is that the neurons, so the pathway between the ear and the brain, those neurons or the brain realizes, hey, I don't hear any sound. And I need to hear sound. Like I have deprivation here, and so I need to find that sound. And what those neurons start to do is they become hyperactive. And then we think as a result, somewhere between the ear and the brain, it makes its own sound.
Wow.
So it's also called like a phantom sound. So meaning like you can't hear mine and I can't hear yours. There's like 1% where there is a form of tinnitus that you can hear.
Oh.
But I've never seen it in my career.
Okay.
But most of the time it's a phantom sound. It's the same thing with the hearing. So let's say like our cells of hearing are starting to die away and we're starting to have symptomology of hearing loss. Well, what happens is your brain notices, hey, we're not getting any sound here. Now this is for adults. So adults, the brain has already been mapped out. This part is for touch and feeling and motor control, and this part is for hearing and understanding what you hear, because we really hear at the level of the brain. The ears are just natural amplifiers and filters for noise. So what happens is when we lose hearing and the cells begin to deteriorate and die, we begin to have hearing loss. Well, the brain identifies that, and then it's like, I'm going to move from this part of the brain and try to make this area of the brain be the designated area for sound interpretation. Well, that area is a frontal lobe, and that's responsible for memory and for decision making and, just all the executive functioning. So people with hearing loss are anywhere from 200 to 500% at risk for dementia later on in life, because the brain's trying to fight for real estate, essentially.
Wow.
Oh, that's crazy.
Yeah.
That's not good for me, because Callie already, she's like, you cannot hear.
Yeah. I also just think you're ignoring me, but that's not the thing.
Yeah, I mean, you never know. Right. And it could be a attention thing, or it could be, a hearing thing. Like, I know for me, so we do complete, full comprehensive. We do more testing than essentially anywhere else. So with me, like, I know at the cellular level, because of my objective measures, that my cells are beginning to die in the high frequency range. So, and I already kind of knew that, because here's the thing: when I start wearing my own devices, my own hearing treatment, my hearing aids, my husband said a simple 3-word phrase. I could not detect the beginning of one word and the start of the next word. It sounded like jargon.
Oh, wow.
Yeah, and that's when I realized, I'm like, okay, this is an issue. And then also I'm starting to like my television with captions on. Yeah, so so that's when I started to treat myself.
So interesting.
So what is like I've never been to an audiologist, and the last time I had my hearing checked, I think I was like in the 4th grade.
Yeah, so typically, for adults, you want to get checked at 50.
Okay.
50 is around the age you want to get checked, unless you suspect there's decline sooner. Like, I'm 46 and I just actually I'm 47. I just had a birthday the other day.
Oh,
so
happy birthday.
Thank you. So I start wearing mine at 46 when I start to have all my symptoms.
You started wearing your
Hearing aids.
Okay.
I have hearing aids on underneath all this stuff.
Awesome.
Yeah.
So what does that exam usually look like if they're wanting to just come in? Like if you're like me and I'm like, well, I'm around loud noises all the time at the dental office.
Oh, I know. Like, usually the dentists get the high frequency hearing loss because the drills that you're exposed to. Yeah. So what it looks like is that the first thing we're going to do is, after we take, your information and do all the paperwork of just being in the office, then we're going to do an assessment on cognition. And we're going to get a baseline of your cognition, your cognitive abilities. And for mine, it's a full assessment, because I'm a speech pathologist. It's not a screener. It's a full assessment. And then after that, you're going to go through testing of, testing with speech and quiet and speech and noise, and then your typical beep test. And then I have the objective measures of just assessing the cells. What are your cells doing? And because those objective measures are so much more sensitive than the audiogram itself. Yeah. Like, right now, I have hearing loss at my cellular level, but if you do testing on me, it looks like I have perfectly normal hearing.
Wow.
Yeah, because 50% or more of the cells have to be damaged to be detected on the audiogram. Only 20% need to be done on the objective measures.
Wow.
So are there interventions that you can deploy to, I guess, delay the deterioration of your hearing?
It's mostly hearing conservation. So, when you're doing your drills and things like that, I would wear hearing protection, that kind of stuff.
They tried to get us to do that in dental school. None of us
nobody likes it. Yeah. So doing that, as well as just, what I teach my kids when they're wearing their headphones and listening to their gaming stuff, I'm like, do not go above. I tell them 40%, it's really 50%, but they're going to stretch it. So, so I tell them, do not go above, the 40% marker of that volume bar.
Okay.
Things like that, just to keep my kids healthy and to keep everybody healthy.
I know. I turn my earphones on too loud. I love to jam out to music.
Yeah, I know.
And I'll just crank it up in the car.
I know. I do the same thing. Yeah. So I mean, and here's me. So I have genetics. So it runs in my family. The women tend to lose hearing in their late 40s, early. We're a little bit earlier. So in general in America, it's very normal. Like at age 50, men. We start to lose our hearing. Age 40 it's 40 years old for men. It starts in their 40s, but they're just not aware of it.
Yeah.
She's
Yep.
eyeballing.
Well, I mean, okay. So also, if we send somebody to see you, are you clinically doing this now, or do you kind of oversee? Like, if my parents came in, would I be like, go see Michelle, or like, what?
I typically don't treat patients anymore unless it's like my patients were requesting me specifically. But
Sure.
the team that I
bet
that
they're
I
great.
have, so the team that I do have, they essentially do exactly what I do.
Perfect.
You know, I am at this point in my life. I mean, I do management mostly over the SLPs and over the audiologist, and then also, you know, the cognitive assessment. I'm the only clinic in this area that does this
With
at
it.
all. Yeah,
Right.
yeah, it's a part of my protocol. And actually, because I do that, the company that I use the CogniView, so that's the particular assessment that I use.
Right.
They hired me to teach audiologists across seas and in this nation.
Oh, that's amazing.
And how to get it integrated into your practice, because it is great, vital information. So like if you had hearing loss and if we got all the baseline, that's what I get all the baseline data. And if you need treatment, then what I should see is just like how I told you that we start to get that memory loss, dementia happening with the loss. When I start treating and giving you that stimulation through the hearing aids, those numbers should go up.
Yeah,
It
that's
starts to
fantastic.
repair itself because of, again, the neuroplasticity of the brain.
So what is this cognitive test? Like,
It's
you keep saying it, and I'm just,
I know. So it's really amazing. I love it, to be honest with you. That's why I'm like, oh my goodness, it's amazing. So most of the time, my cognitive tests are me face to face asking you questions about memory and problem solving and reasoning. Well, this particular test is a computer, like it's like a device. So you sit in front of this screen, they're going to tell you the directions, and you literally turn a wheel. So it's not heavily language based. It is some language, but we have to try to rule out that part. So it's like visuospatial information, attention, memory, reasoning, and it gives you all that information. And it's not like a tester bias. There's no tester bias because I don't administer it.
right.
You either get it or you don't.
amazing. Right.
I know. It's amazing. I love it. Like
So
I
you're
integrate
spinning
it.
a wheel, and
Yes.
it's asking you things.
Yeah,
and so
like
is
it's
it-
asking
if
you to
pause or,
like which words did you just see, and then you just spin the wheel. It's kind of like moving the mice
oh,
around.
okay, yeah, to select it or whatever.
Yeah.
Okay.
Mhm. And it takes also in regards, because I could never do this as on my test, like your processing speed.
Yeah.
And your reaction time.
Yeah.
You know, I can never get that
That's
data.
awesome. That's awesome.
So yeah, so it's a comprehensive, it's amazing. And it's so surprising how hard it is to get this protocol to run smoothly in the practice, but it is. It's just something different.
yeah.
I want
for
to do
sure.
this.
I know you should. We should. I'll go do it too.
And I want to do the hearing. I want to make sure my hearing is good too, because maybe Callie's just saying too much to me. You know, I think.
I mean, if we rule out that you don't have hearing loss, I'm just going to yell at you more to get your attention. I'm just kidding.
just be more careful with your words. I can only take in so much in one day.
Yeah, I mean, it's just, and it just means your attention, your focus and your attention is just being spread to a lot of different areas, and it's not really uncommon for us, right?
No, for sure.
I mean, that's our minds
Especially
are
at work.
constantly
Yeah.
running. I don't even I have a hard time shutting my brain off at nighttime.
Yeah, he
just
wouldn't
to
know what
sleep.
that's like either. Yeah.
Yeah. So,
I mean, we do. Yeah.
yeah.
It's
So
amazing.
yeah. So that's a.
We're
so
all
yeah,
going to
so
make
that's-
appointments. I'll get Bree to schedule appointments.
Yeah, yeah. So yeah, we can do all that stuff. But that's what it looks like. But it's all about getting the baseline, knowing how you do, functional testing, and then the
Right.
typical beep testing. But yeah, it's a very involved, comprehensive test, and we've always done extra. And that's how I got my name out, because I think the patients that I saw, because in those early days, I didn't have a lot of marketing money.
Oh, yeah. No, for
It was
sure.
like
Absolutely.
physician referrals
Yep.
and other patients. And they always told me, even to this day, they're like, you do so much more. What is this? I don't
Yeah.
even know what this
Yeah.
is. And it's like, now that I have this CogniView in there, I'm like, yes, absolutely.
Well, it just elevates you in the patient's mind too. I mean, they come here, everything's digital. We're doing sleep studies. We're talking about their overall health. It's not just, oh, hey, you want to like bleach your teeth. You
I know.
Like,
Yes.
or it's not just like, oh, you've got all
Right.
these cavities. It's such a bigger picture.
It
And
is.
I think our cognitive health, especially when you're talking about like trying to reverse some of the dementia things that
Yes,
are happening. Like,
exactly.
who is not going to go do that test?
I know.
And if it's as simple as wearing a hearing aids, you can hear better. Like,
I know.
That's outstanding.
And it's
Yeah.
really sad, because this industry is so like flooded with a lot of miscommunication, a lot of poor information.
right.
The devices that we work with are medical grade devices. They're not an amplifier you're going to get at Walmart or at Costco.
Yeah. Oh, so they
Like, yeah.
can go get stuff cheap off the counter and think they're getting the same thing as what
Yes.
you're implying. Yeah.
And that's
that
what
in-
they're told.
Wow.
That's
Is
what
that
they're
a newer
told.
thing with those appliances? Sorry to interrupt.
No, go
I
ahead.
feel like I don't feel like I've seen so much marketing material for a hearing aid in my life, but
You might be coming of age.
that might be it.
Yeah.
Facebook's hitting me up.
Well, I've seen them at Walmart before, but you also don't. I mean, we don't have time to go like in store shopping much. So I think there's
Wow.
some things that we're just like missing. But I used to just go to the store.
Do
I've
you want
seen
to
that
go to
too.
the mall? I'm like, are you kidding? I would rather
Yes.
sprain my ankle.
So funny.
Oh my gosh.
I know. It's so interesting. I'm the same way. I've never been a shopper. I've never done any of that stuff.
I'm
never.
a hunter. I'm like, I know
Oh,
what I
you're a
want.
hunter? Okay, that's where
we're
we're
I don't
different.
actually hunt.
Oh, okay.
But that's how I go shopping. I'm going to the
hunter
store
gatherer,
for this.
you know, like I'll just go
I
scroll
just
the
need
aisles.
this.
Like,
Yes.
yeah.
Yes. Yes.
Callie's like, I got a basket. I might as well go see what I can fill it with at the store. And I'm,
Right.
It's rare that I get
I
to
go to Home
so.
Depot for the hammer. I don't go to Home Depot because I want
Right.
to see how many hammers they have,
Right.
colors. And,
Yes. 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 I mean, we all have our thing.
Yeah.
Yeah.
Well, I just think it's fascinating because everybody's talking about dementia, Alzheimer's, aging, how to improve the longevity. And really, we were talking with the staff today because we were at the Breathing Wellness Conference last week where we were both speaking actually, but there was a cardiologist there talking about how we are saving lives if we can get in and improve their sleep and their breathing before they ever hit the table for a defibrillator or heart surgery or whatever else. Like just really motivating. But Kyle, came in and talked with the staff this morning. He's like, if we can improve somebody's health span, it's not just how old can you make it to?
Right.
What
in
is
America,
that
we
quality
can
of life?
get anyone to 80.
Yeah.
Oh, I know.
Anyone to 80.
Yeah, but the thing is like, can you physically make it?
Exactly.
And do you have your marbles?
Exactly.
Yep.
Exactly.
Because we don't imagine ourselves, I think, it's kind of a wake up call would be to step in a nursing home.
Absolutely.
Yeah. Go
100%.
step in a sniff unit.
And
That's
so-
a wake up call because nobody imagines
You don't expect
that
you're gonna be
phase
there.
of your life
Right.
before death comes on.
Right.
There's a longevity physician named Peter Attia who wrote a book called Outlive, and I think it came out recently. And so I listened to it, and in that he describes that phase of life as your marginal decade, as when you are technically alive, but it's not a life that you would compare as like right now we're calling these our golden years, right? This is the best time of life. My kids are young, I have energy, we have time, we have health, we have all these things. And as time goes on, that deteriorates to a point, and it deteriorates to a point to where like, okay, well now if it's rainy, I won't drive somewhere. I really want to go to see this movie, but the weather's bad, so I'm not going to drive. And then that kind of how that tipping point happens, and it's like, well, I'm taking 1,000 medications every single day.
Right. And you have the polypharma. I mean,
Yeah.
only
Oh my gosh.
4 or more is considered polypharm.
Yeah.
That is crazy.
Yeah. But it's just, to me, I'm like, any way we can improve that aging. I mean, the dementia Alzheimer's discussion with sleep is huge. I mean, they've noticed that patients that have been diagnosed with that do not get any deep sleep.
Right.
If you do not get deep sleep, that is the washing machine cycle of the brain.
Right.
So the brain cells, obviously, tons
Right.
about the brain, but it looks like a giant starfish, right? The glial cells extending
Yes.
out. Now, when they go into deep sleep, that shrinks, and that's what allows the lymphatic system to clean out beta amyloid plaques. We all know what those are
Yes,
with Alzheimer's.
exactly.
If you never get into that deep sleep, they never shrink. So you never get the filtration.
Right.
And so I'm like, if we can improve their hearing, make sure they're breathing at night and getting oxygen, we are going to age better as a society from what I can tell
Absolutely.
from what you're saying too. Yeah.
Absolutely.
And
And
it's
that's,
critical.
it is critical.
We need to save the world.
Okay. It's critical. We have to, if everybody could just take a moment and just envision, like we're going to age better if you can envision your older self and trying to prepare your older self for whatever. So like right now, like I'm 46, I'm wearing my hearing aids. I don't have a problem with that.
Absolutely
Getting in,
not.
yes,
It's not a
remembering in my
pride thing.
protocol, my daily routine was an issue, but once I got past that, it was fine. But
Right.
I'm going to do whatever it takes because I want to have a better quality of life.
Yeah. And I'm sure the transition to that, like you said, was a little,
Yeah, because it's
getting
just an
used to
additional
it. It's not
step.
much different from oral appliance therapy. So
Yes.
if a patient needs to wear something that, gently holds their jaw forward to keep their tongue out of the back of their throat, you're going to have some nights where maybe you didn't wear it or you pulled it out in your
Right.
sleep or something. But once they get it into their routine, that is when we see the numbers and the blood pressures drop and their overall cardiovascular health get better. So I think that's a good point when you're starting anything new like that. Give yourself a little bit of time to get used to it.
Yes.
And you're just going to be a healthier person.
Yes, you will be. It's I don't know. It's all about quality of life and just if I'm going to live to whatever age, please, let me help myself, make sure that I can physically
absolutely.
manage it and like cognitively be there to manage it.
Yeah.
Yeah.
Yeah. We have to, we have to do that. We have to
we
think
have to
about
take
it
care
that
of
way.
ourselves.
Yes. Yeah.
Right.
Okay, I want to ask some pointed questions that maybe, and no one prepped me for this, so it's
Yes,
probably a
go
dumb
ahead.
question.
No dumb questions.
Great. Then now you just opened
Yeah.
up. So I was curious about if you have seen any relation between any of the testing that you do or any of the patients in your practice in terms of like a cohort of people that have been diagnosed with ADHD compared to those that have maybe not been diagnosed with ADHD. Have you seen any kind of connection between anything?
Between like, so people with ADHD versus people that have not been diagnosed with ADHD, but there's like overlap behaviors. Is that what you're saying? I'm sorry. Let me just make sure I understand the question.
This is why it's a dumb question.
No, it's not. Do you have ADHD? Is that, I'm sorry, is that
Several
two
times
person?
a day. But
Okay, no,
I
doesn't.
have
He
it.
doesn't.
Okay, I've been diagnosed with that recently.
No, my mom told me when I was in high school that I was diagnosed with it, but she didn't want me to go to that clinic because I don't think she liked the teacher that was teaching.
So she just guarded you from that.
She just
like
said
you
no,
just coped on
and
your
then
own.
I didn't find out till anyways.
It's like, when did she tell you this?
But for my sisters, they got diagnosed with it too, but so they got twice as long to take the SAT that compared to me.
Oh, I had no idea. We were high school sweethearts. I've literally known you longer now
That
than
is
I haven't not
amazing.
known you.
That
and I've
is
never known
so
this.
unique.
So yeah, that
is
and like
great.
dyslexia and all those
Yes.
wonderful things. So
Yes.
So anyways, I made it to here.
That is
Fine.
amazing.
You have to go see her. That's going to be amazing.
Yes.
If we bullshit. I want to too.
Oh, thank you.
Yeah.
Yes, absolutely. So the ADHD versus the non-ADHD. So what are you?
What's the question is what she's
Yes.
asking you.
I don't know the question. I guess the question I was wondering is there something that stands out to you as patients in your practice with ADHD as compared to without? Because we understand that 50% of the symptoms are overlap with sleepiness as with a diagnosis for ADHD. And it was really interesting because there's this really cool study called the Dundon study done in New Zealand. Have you ever heard of it?
Oh, you would
Fine.
love it. Find it if you
Okay.
haven't.
I can't remember his name. And actually, I think the founder of the study recently passed away.
Oh, man.
But they started this 50, 60 years ago in New Zealand. And it was 12 or 1,300 kids who were born in those 2 years. And they said, we got some money. We want to follow you for as long as you are alive.
Right, like a longitudinal study.
Yes. And so
That's amazing.
Another one like this will never be done again. Right.
Right.
This is so cool. And in that they found that, kids who were able to pay better attention in school, meaning they were, and also connecting it to being less sleepy in school, meant that the quality of life was better, their income was better, they were more likely to get married and stay married, they're more likely to have kids, more likely to have a good job that they like, whether it's high paying or not high paying, like all these other things that we all would want in our own lives, especially for our kids, like things that we relate to happiness and joy.
Right.
And to measure them, you can't, I don't think they actually tried to say those words, but and they did that to the ability to pay attention. And I imagine if you are struggling to hear or comprehend,
Oh, I know.
then there could be a connection.
It's really sad. So another thing that I do is I'm a medical reviewer. So I review insurance claims that are denied and then the families, which I highly recommend to all the families that are listening right now. If somebody denies, coverage and they say they're going to cover it, you appeal it.
Yeah.
So I'm a peer review. So I review SLPs and I review other audiologists, the stuff to try to honestly push it through.
Yes.
Because it's quite a corrupt world out there.
Yeah.
But anyway, yes, there is a true link between our kids' first speech and language disorders. A lot of times, and this is what drives me nuts, a lot of times they're just like, it's a developmental disorder. Well, okay, if it's a developmental disorder, that means that it's going to repair itself all by itself naturally. It just is kind of developmentally just late.
Yeah.
Right? But really, speech and language is more neurological, right? We have the centers in the brain for speech production and speech understanding. It's neurological disorder. For my kids that have a speech and language disorder, and then it goes into like a articulation, like they can't say certain sounds right, but now we're going into language, like a phonological disorder where it's a pattern. Like, for example, the kids will eliminate final consonants on every single word. It's a phonological disorder versus an artic, because artic was a specific sound. Phono is like a particular pattern.
Okay.
So when I see those kids like that, and there's studies on this, it's really just the first symptom. Majority of the time, 50% or more, I don't even know what the stat is, because I personally, eventually, when I get more I get, the more freedom I get, I really want to start doing this research. It's usually the first symptom of ADHD, dyslexia, autism, all the learning disabilities, essentially.
Wow.
Yeah. So there's a high correlation right there, a huge correlation.
It's massive.
When kids are born with like speech and like hearing disorders, if they don't get treatment, and so nationally, they should have treatment. They should be identified as an infant. They should be diagnosed at least by 3 months, and they should be treated no later than 6 months. But if they don't go through that, and the family's not aggressive, they're at huge risk, even for the speech disorders. So speech disorders, when they go untreated, hearing disorders, when they go untreated, their quality of life totally goes down. Like there's a study in 2005 by Thielen and Associates. What he noticed was that academics is going to be low.
Yeah.
And then vocational options are going to be low.
Wow.
Like it's going to follow you the whole way through if you don't get these foundations.
Wow.
Because you need hearing to learn.
Yeah.
Absolutely.
And you need speech speech and language is the foundation to pre-K and kindergarten to learn, to keep on learning.
Right.
So there's there's detrimental effects if it goes untreated.
Right.
Yeah. And I don't think parents and families realize that.
Mm-mm. Well, no. And if they're not being told that at the pediatrician office either, or if they're just not getting access to that information.
And there's still pediatricians out there to this day that's like, oh, you're going to grow out of it. And we're seeing these 5 years old.
I was about to ask if that was because that's what
It's
they
not-
tell.
They're telling that about the jaws and the tongue ties too. So
Yeah, if your kid snores, you'll grow out of it.
No,
You'll grow
they
out of
don't.
it.
Like snoring's not a good thing.
No.
Period. We shouldn't try
Ever.
learn
Full
that
stop.
from you.
yeah.
And now I know to tell my parents this stuff because now we ask.
Absolutely, yeah.
But like that kind of stuff shouldn't be a normal thing. But I don't see it as much as I did probably like 10, 15 years ago. But nowadays I still have those few, and they're typically older physicians that are still practicing. And they're telling them like you're going to grow out of it, and it's like, nope, you didn't even
we
start
were literally
early
told to say
intervention.
that in dental school though.
Yeah.
So like I can imagine that they were also taught similar
Probably
things.
so, but it's our responsibility
100%.
as professionals to keep abreast of your
100%.
research,
Yes.
to keep abreast of what the
Yes.
changes
It is
are.
no excuse.
That is no excuse.
No excuse.
And that's why I'm like, I advise family members and friends. I'm like, if you're looking for somebody, you'd probably want to go like middle age.
Yeah.
Yeah.
Just
or
enough
at least someone who is enthusiastic about seeing you in their practice.
Oh, I
'Cause
know.
There are plenty of older dentists out there who love CE. There are plenty of young dentists out there who are terrible at going to CE because in Texas you only have to do 12 hours. Is it over 2 years? A year. And we do a lot, so I don't have to count the beans. But there is anecdotally, when we were looking to grow, we used to buy practices. Now we build them from scratch. And so I went out to see dozens of practices. And these are all practices that were affordable for us back then. They're not like huge high performance practices. And they were all the same. Well, I've done it this way for 25 years.
I know.
Everything.
And then you go into that organization and you can't even change it.
Oh my
because
gosh, yes.
The organizational culture
It's
takes
petrified.
years
It's
to
calcified.
change.
It's calcified.
So that's why you have to just go start from
Absolutely.
scratch.
Yeah.
It is so much
That's
easier.
why we hire new graduate dentists as well and train them.
Very good.
Yeah.
We
Yes.
hire soft clay, not hard rocks.
No, I totally understand. You should come to my practice. I
Oh,
have a
can't
lot
wait.
of young. I have
Yes.
a lot of young therapists.
I love it.
I try to mold them,
Absolutely.
and if they weren't like my student or my
Right.
fellow from before, or if they were older, they were my student or my fellow from before.
That's
So
amazing.
yeah. So
Yeah.
I mean, I
So important.
I totally agree because they're not. I don't know. I guess they're just not as jaded or biased, or they're more open to ideas. I mean, I'm sure there's a few that's gonna, there's a few out there, but
Yeah,
I
no,
find
it's
it-
important, and just to have the respect of your leadership and authority, and to trust what you've built to replicate that, which is exactly what we're
very true.
doing.
Yes.
And it's like me asking, like, "Hey, can we see you?" That's always the question.
Right.
Like they want to, and I'm like, I'm helping everybody now. I make a bigger impact,
Right.
But not being in that same room from 8 to 5. Although I'm still here a lot, but it's like,
Right. No.
it's true. You
Yes.
know, we have a bigger reach when we can teach, train,
Yes.
and then
Exactly. So that's that's something that we try to do too.
Well,
this was just amazing.
This was-
I mean, we're so linked with development.
Yes. Oh,
like if they can't hear and if they can't breathe, they're not
I know it can be very detrimental. And hearing loss a lot of times, especially in the kids, and especially when it comes to just one ear, if there's like a unilateral hearing loss, it's very sneaky. It's hard to catch. So even if anybody has the slightest like suspicion, just get them tested.
Absolutely.
Because it can be. I mean, these kids are. The kids, when they're born with it, they can work around it because of the neuroplasticity of the brain, right? They'll start using other senses, the keener sense, they'll get keener in other areas. So it's hard to find.
So on that, like we tell generally we tell people, bring your kids in whenever you come in for happy visits as soon as they're born. That way they just kind of get used to the practice. And then when they really need to see the dentist is when they turn 1 year or when their first tooth erupts, or if they have a tethered oral tissue or something along those lines. But for, I guess me as a dad, maybe Callie knows different, but the only time I ever thought I needed to get my kids' hearing checked was at birth, and they did it in the hospital, and they charged us like $150 per ear or something like that.
Oh, wow.
Yeah. We didn't have any insurance side.
Okay, I see. Yeah, wow. Yeah. So yes, typically it's infant screening, and they get it screened then, and then your pediatrician will screen again around age 3.
Yeah.
So if there's any suspicions between those years, you should come in to an audiologist that's special, that sees children too.
That's great.
But that's, and then, the teachers, you watch things like once they get into school, if there's, they can hear well, and if their grades are good, that kind of stuff. Yeah.
So to come into your practice as a new patient, like if I was going to bring myself or my kid in, do I need a referral from a physician?
No.
Okay.
No, unless your insurance dictates that, unless like you have an HMO. An HMO, you're going to have to go through your PCP. Okay. Yeah, those are the, that's who, essentially the gatekeeper. But if it's a PPO, no.
Okay. Well, what about Medicare?
Medicare we accept. Okay. Yeah, the only thing that we accept all major medical insurance. The only thing we don't accept is Medicaid.
Okay.
Yeah.
Sure. Is that typically not offered for audiology and similar services, or is it just you struggle to find that as a good fit
with
for your practice?
It's not a good fit for the practice, just from a business point of view.
Right.
It's just not a good fit for the practice in regards to like it's coverage, payment, if there's a change, sometimes you don't know until like months later.
Yes.
Yeah. It's not different. It's no different dental.
Yeah. So like it can really affect your cash flow. Yeah. And really if it's a significant change, I've seen businesses go under.
Oh my gosh.
And not be able to do payroll
for sure
because there was a change that happened.
The way most dentists make it into the news is they commit Medicaid fraud in Texas. So every couple of years there's a big old sting and there's millions and millions of dollars.
So sad.
It is.
That's terrible.
It's very profitable in a high volume practice. Here, but we don't offer any. We don't take Medicaid because it struggles to fit into our model.
Yes,
and so that's really interesting that you don't take it either. What else? Like, Callie and I don't have health insurance, and it's just kind of how we've rolled for the past several years.
We have a MediShare.
Okay, yeah. So you have like the kind that's like in case anything detrimental or catastrophe would have happened, that's what you have. Because that's at least you have that. That would be
for
something
sure.
I would
It's
recommend.
actually been great.
I had shoulder surgery last year for a rotator cuff, and I mean it cost nothing.
Yeah, they covered all of it. So it's different than just catastrophe. We have Christian Healthcare Ministries.
Oh,
so
interesting.
You just have to be able. You're considered cash pay where you go.
Mm-hmm.
For a whole family, it's like $700 a month.
Yeah, maybe $600.
And that's really good.
So they have like a medical event. If it's over $500, whatever the medical event
at
is,
100%. Yeah.
If it's over 500, they cover everything over 500. But if you can show that you negotiated with that hospital, physician's office, whatever, and you saved more than 500 by negotiating a cash price,
then they'll cover all of it.
They cover everything.
Yeah, like my C-sections were 100% too.
Really?
Yeah, it's great.
It's really amazing.
Yeah.
Have
you ever heard of Christian Healthcare Ministries or Good Samaritan?
A friend of mine has done something
awesome.
like that. I'll have to take a look into it. So, in my industry, in order to get, we're so few and far between. Mm-hmm. In order to get employees, you have to offer those benefits.
Yeah.
Yeah.
Oh, we know that. We have that here.
For you. I know.
It's very expensive.
Yeah. We offer now, but it was a long time before we could even consider it. I mean, maybe we've only done 2 years. Yeah.
Yeah. I mean, I've been in business, 12 years. I've been offering it maybe the last 5 or 6 years.
Okay. Yeah.
Yeah. It took a while before I could make it to that point. Mm-hmm. So people were part-time.
Yeah.
Or they were full-time with no benefits.
For sure.
We couldn't afford it.
No, it's too expensive.
It's very expensive.
Yeah. Well, CHM is so affordable. It's $175 per person. And then your kids are all one fee, no matter how many kids you have.
Okay.
So they're all.
Wow. That's interesting.
And they're huge limits too. I mean, like
There are pre-existing conditions and stuff.
Yeah,
It's not like regular,
But I mean, it's been really good it's been an awesome fit for our family. But I've encouraged all of our employees to do this, and it's untraditional, so it feels unsafe, right?
Yes.
It feels like, oh, I'm going to get screwed here. And the caveat is,
Well, honestly, when it comes to medical insurance, you're going to be screwed either way.
Either way, your deductible
Either way,
is
you're gonna
$5,000
be
or
screwed.
$2,500.
Yes.
Yeah, there's no deductibles with this. Like,
Yes.
so, but you do have to front the costs because it's repaying to you. It's not paying to the
Yeah.
provider. And
so you're cash pay anywhere
that
you
is
go.
the caveat. So essentially, like for our surgery, my shoulder surgery, very expensive.
Yes.
But it was all covered, but we did have to float the cost for a couple of months. So that is, in a world where I've heard, guys like Dave Ramsey and other financial talking heads speak about how little people have in their savings account, it sometimes that does make it a barrier.
Sure, of course.
So they would rather pay more per month. But yeah, we had to offer it after COVID because the labor market in dentistry after COVID had negative unemployment rates.
So many people
the biggest
left.
companies in the world in the United States were hiring brand new, convincing people to leave their non-dental jobs to come to dental because the employment rate was so low. It was zero. Almost all the new hires we made in 20 were people with no dental experience, except for the dentists.
Crazy. They were so scared about getting. I mean, it was
Right.
such
People
a
didn't wanna
question
come
mark for a
back,
long
yeah.
time. Yeah.
So we had a lot of people return, but we were still on a growth trajectory. So we were still needing to hire to fill those growth needs.
Right.
So
Yeah.
Exactly.
But-
Yes.
Well,
I'll
this
have
has
to
just
look
been
into that.
fascinating.
Yes.
Yeah. Oh, you should. 100%.
So what do you guys offer to your employees? Is that what you offer?
no, we have a traditional plan. We have a low, medium, high plan.
Okay. Yeah.
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 Yes.
It's like, I think through Blue Cross for 2 plans and one's United.
Yeah. I don't
Yeah.
know.
But we do cover part of it too. We cover half.
Right.
So
Yeah, that's what I do. I do 50%. Right now we have Cigna. We went from I loved Blue Cross Blue Shield, but they keep on going up
yeah.
and up.
Yeah.
And yeah.
Well, we were able to get the same rate. We just renegotiated like a couple months ago, like I'm sure you did. Was it 2 months ago, 3 months ago? Whenever that window thing opens. But and we ended up being at almost the same rate as we were before, which
Oh, that's good.
yeah.
That's
so,
that's unusual.
yeah. So because we keep hiring on the average age keeps dropping.
Oh, that's probably why.
Oh, yes.
Yeah.
True. That
Yeah.
does help.
Oh, this totally just took a
Absolutely.
tangent. That's so funny.
All right, so this was a 75% entrepreneur ownership,
Right.
self-help,
25%.
and then 25% medical.
Yeah.
Right.
No, everybody's going to love it, though. It was so great having you on.
Well,
Seriously.
great. Well,
how
thanks
can
for having
people
me.
find you
Yeah.
and hear more about what you're doing?
Oh, sure. So you can go to www.speechhearingtherapy.com, or you can Google Autumn Oak, Speech, Voice, and Hearing. Instagram, I want to say it's Autumn Oak, Speech, Voice, and Hearing. I think it's the name of the business, and the same with Facebook.
Okay,
So we're
Autumn
on
Oak Therapy. I can confirm.
Autumn Oak Therapy is
Yes.
Instagram. Yeah.
awesome,
So that's where we are,
awesome.
and that's
Well,
how you can find us.
thank you for coming and hanging out with
Yeah,
us. I
thank
really
you. I
enjoyed
appreciate
it.
the
Love
time.
knowing you.
Yes,
and you're such a
likewise.
force to be reckoned with here.
Well,
so I'm
thank
just
you.
excited.
Yes, likewise. Thank
Yeah,
you.
Absolutely.
Thanks
All
for
right,
having me.
That's
Thanks,
it.
guys.
All right. Thanks.